think the idea behind this project is really once you identify people who have mutations, how can you help them act on those mutations and help prevent their risk of ovarian cancer or breast cancer? And for me, once we identify them with a BRCA mutation, we have tests that can help reduce their risk of developing cancer or detecting it early. And so I think early detection and prevention, that saying an ounce of prevention is worth a pound of cure, is really true. And I think investing in those resources are extremely important. As part of my career, I think it's incredibly important that we focus on putting efforts into prevention. So I think this is just the start of hopefully a long career and efforts into increasing that for ovarian cancer, cervical cancer, and other gynecological cancers across the board. This grant means everything. It's just, an opportunity to really start with a project, start from start to finish and really see it through. And I think it's just going to be a springboard for future projects as well and future studies and hopefully making a world of difference for patients with gynecological cancers. While we don't have great screening tests, we do have opportunities for women who have these mutations to help prevent them from developing ovarian cancer, or at least detecting it early. And so I think that's the future for us. And I think there are lots of futures. I think there's incredible advances we're making in how we treat ovarian cancer, what happens. But if we can help prevent or detect it early, we can really save lives. And so the work that the National Ovarian Cancer Coalition is doing is just incredible. And I am so grateful for them for investing in both treatment, but also helping prevention or helping people who've been identified with mutations that put them at increased risk. So some of the earlier signs of ovarian cancer are bloating, nausea, indigestion, things like that. They're very subtle, so it's really hard that's why it's tough. Like a lot of the time we identify ovarian cancer when it's very advanced and it's already spread within the abdomen. I think we're very good as women at minimizing our symptoms and not really just chalking it off to feeling a little bit off. But I think it's important to listen to your body and bring up your concerns with a provider if you do have them, because it's extremely important. You're the only one who can help identify those symptoms earlier and help bring them up with a provider who can help further testing. In the future, I would love to continue to do this work. This is trying to help individuals who are medically underserved. It seems like a scalable option that we can help with helping people from an educational standpoint. How can we teach people about what are the screening tests? How can we teach people about what are the surgical options they have to help reduce their risk? But from there on, some of the bigger things are looking at like policy levels, right, and helping alter those. The biggest barrier, right, is cost for a lot of patients. And how can we make that more accessible? What kind of interventions can we do, or how can we increase access? And so I think those are going to be the next steps as I move forward in my career to try and think about. I'm just unbelievably grateful. Your generosity helps young researchers get going and really sets the foundation for them to continue. I feel like this is just really setting up my career and my future research and my interests, so I'm very grateful. And then for patients, I'm so grateful for every patient from what I learned from them, but also the generosity that I find when people are affected by cancer and how much they want to be involved in research and also furthering to help people in the future. So I'm also incredibly grateful for the patients.